Hi everyone, I'm Olivia, and today I'm just going to share a little bit about the impact of aging on fall risk and injury. So it's been such a pleasure to get to know you all this semester, and I thought I wanted to do something that was applicable to those in cardiac rehab, considering that most of you are in an older stage of life than us college students, and it's been so fun to hear all of your stories and get to know you all. But I wanted to do something that was more applicable to as you continue to age, that phase of life, stepping into that phase of life. So I want to talk about the impact that aging has specifically on fall risk and injury. So in doing some research on a lot of the types of injuries that older populations encounter, one of those was a lot of them were caused by falls. And so I wanted to talk about fall risk, how we can negate some of the effects of aging that it has on the risk of injury. So let's get into it. So what happens to the body as we age? There are several different things. We obviously know that our brain changes, our musculoskeletal system changes. So neurologically, the brain loses some of its capacity to transmit signals and communicate as everything the cells are deteriorating. There can be impaired cognition. So that would have to do with like a decline in processing speed, inhibition of environmental stimuli, sensory losses. And then going along with that, the next bullet point that I have is vision and hearing function can decrease. So when I was thinking of the inhibition of environmental stimuli, when vision and hearing are decreased, that inhibits the amount of environmental stimuli that an individual can take in, and maybe it's more difficult to be aware of their surroundings, and that can cause a greater risk for injury, as maybe you're not as spatially aware, maybe you can't see dangers that are there, that are present. Sensory losses, so maybe like the loss of touch receptors in your hands, not being able to perceive pain, things like that. All of those can contribute to a greater risk of injury, as you're not able to perceive threats or dangers around you. You're just not as aware. And obviously there's different things to combat that, like hearing aids, glasses, things like that. And maybe some of you have some of those in order to combat the vision and hearing function or things like that. And then musculoskeletally, I wanted to kind of focus on that. So I defined sarcopenia on this slide, and that's the progressive loss of skeletal muscle mass and strength. So as the body ages, there is this progressive decline in strength. There's this loss of muscle mass. On the next slide, I shared pictures of cellular, like on the cellular level of muscles. So our first picture, we see the young and healthy muscle. On the left, you see the picture of the bicep. And on the right, then you see these muscle cells. They are big. There's not a lot of adiposity between them. The cells aren't damaged. Young, healthy muscle cells. And then on the bottom, we see the old atrophied muscle. On the left, it's smaller. It's like not as wide as the young, healthy muscle. Now, this is termed, like I said before, sarcopenia. And on the right, you can see the muscle cells. They're smaller, they shrank. There's more adipose tissue between them. They're damaged. So I just wanted to draw this distinction between the younger muscle and what happens to the muscle as an individual ages. And these two different pictures are just under like different lights and different cameras. So there's not much of a difference between the two for like the young muscle and the old muscle. But just to give you an idea of what happens on a cellular level to the muscles as we age. So I wanted to talk a little bit about strength decrease with aging. So strength can decline up to as much as 3% per year after the age of 60. I found this in my research. And I also found that it was higher in sedentary individuals, that this was a faster progression than individuals who are involved in exercise programming. So skeletal muscle strength and force production decreases as like the muscle fibers decrease in size due to like this decline in the functional capacity to produce protein. So obviously producing protein is super important in repairing muscles, building new muscle fibers. And so this isn't really happening as much as an individual ages, and this force production will decrease because the muscle fibers are decreasing as well. So that's just kind of a fact as you age. And then obviously not having the strength or the amount of force or the skeletal muscle strength is not as great as when an individual's younger. Different functional capacities are going to change. Specifically, I was looking a lot at activities of daily living. So, walking up and down the stairs is going to be harder because there's not as much force production. And then I wanted to just mention quickly, there's also this wear and tear and deterioration of cartilage in the joints. Now, not necessarily specifically the muscle, but also the wear and tear on the cartilage is going to cause the joint mobility to not be as fluid as when the individual is younger. So the deterioration of the cartilage can also cause problems in gait mechanics, things like that. Just normal, again, activities of daily living, ADLs. There's going to be some struggle there with the deterioration of cartilage. So specifically, I want to talk a little bit about fall risk. So to define what a fall is, in a research article I was looking at, they defined it as a sudden unintentional change in position, causing an individual to land at a lower level on an object, the floor, or the ground. And I was surprised that falls occur in more than 1/3 of people aged over 65 each year. So if an individual is over 65, there's a over 33% chance that they're going to experience some type of fall within the year. And not all of these falls cause injury, but a lot of them do. The falls are most common in individuals who require help with ADLs, but it's not limited to that population, because throughout my research, I was seeing that falls can also occur in community dwellers who are just like living their normal lives, and they can also experience falls. And then also to clarify a little bit, falls are not classified as like falls from strokes, like sudden cardiac events. This is not talking about that. This is more just talking about like the functional capacity of an individual in their daily lives. And then falls, what can happen because of them? They can cause serious injury, like fractures, lacerations, head trauma, dislocations. Events like injuries such as these can be caused by falling. And sometimes they're not as serious, but then again, sometimes they are serious. Some statistics that I found for deaths from falls, I was looking at this chart, and as you can see, over the age of 85, this kind of just exponentially increases. Specifically in white males, there's this is per 100,000 people, and this is how many deaths are from falls that cause some sort of injury that cause them to pass away. Not maybe in the moment, but because of this injury that they sustain from a fall. And so 65 to 69, the risk is relatively low, and 70, 74 low, 70, 75 still low. And then kind of once you hit 80, there's this pretty like significant increase in the curve. So I thought that was interesting to note. All right. So mainly what I was thinking about was how can we prevent injuries from falls as an individual is aging. So the research says that exercise programming can reduce the risk of falls in individuals that are 65 years of age or older. And in one research study, I found after 3 months of exercise programming, fall risk and injury were significantly reduced in a group of community dwelling older adults with risk of falls. So this is a population that is at risk, and after 3 months of exercise programming, the risk was reduced. And not only can exercise programming benefit those who are high fall risk, which was the last population from the last research study, last bullet point, but also those who are not. I also found a research study that said that implementing exercise programming decreased the odds of falling by 0.85 among individuals 65 years of age or older living independently. So we have this preventative measures that we can take through exercise programming that can help prevent risk of falls. And then also people who are at risk, it can also benefit them as well. So there's these two different populations that I was looking at. Exercise programming can benefit both of them. And then I was thinking about what type of exercise programming is beneficial. So at a study I was looking at, there was this U-shaped relationship between injury and how active an individual is. So the most active and the most inactive individuals in an elderly population are at the highest risk for falls and injuries. So the least inactive people and the most active people, because the more activities, the more exercise you're doing at a really high intensity, there's going to be greater risk for injury than if you don't do it at all. But also the people who are never active, who are extremely sedentary, there's going to be this risk of just huge deep losses in muscle mass, and then the functional capacity to perform any sort of activities of daily living is going to significantly decrease. And then there's going to be a risk for injury there that is similar to the risk for if someone is extremely active, but it's going to be because of different things. So I looked at some studies that were saying that low impact exercise, balance, coordination exercises, especially for individuals who are maybe later 80s, past the age of 85, you're not going to give them this super high intensity workout. You're going to adapt it to their age and what stage of life they're in. If they're 65 versus 85, it's not going to be the same thing. But also coupling this with appropriate strength training and cardiorespiratory endurance exercises. And studies that I looked at said it was most effective when combined, like different types of exercises are combined. So you're not just going to do like low impact and balance, you're also going to add in some strength training as well. And then also I was finding from the research that balance and coordination movements were extremely crucial in preventing fall risk. So that's kind of part of the reason why we focus on balance in cardiac rehab so much. You all have the opportunity to be enrolled in this community program for exercise, and it's a really great time to not only prevent cardiac events, but also work on musculoskeletal strength to prevent fall risk as well. So the benefits are a multitude of benefits. And yeah, I thought that I would focus on balance exercises for my workout, since I specifically mentioned that in my presentation. So attached to my portion of the blog is a balance workout that you can add to maybe the end of your workout if you want to couple it with some cardio, or add it to the end of your strength training. That would be a good place to put it. Just like 5 balance movements that you can focus on, kind of connecting your mind to your body and really just focusing on establishing this balance. So basically, overall, just thinking about how exercise programming can be beneficial in building strength in elderly populations and preventing fall risk and injury. And here are some of the references that I use. Thank you all so much for listening.